everyone. Thank you all for joining us today for OneLegacy's first ever virtual town hall series, Connecting the Dots and Engaging Our Community. Connecting the Dots is a platform we've created where you can hear from experts in a specific field, and the experts can also hear from you. My name is Tiffany Jones. I am the Public Education, Communication, and Production Lead here at OneLegacy. And we are the front lines of educating people about donor registration and awareness. Our goal is to educate the public so people eventually feel comfortable to join the donation community. We are excited to kick off the town hall in June during Men's Health Month. Then obviously with all of the social unrest going on in our country, we would be remiss not to discuss systemic racism and equality in today's topic. So the goal will be to discuss reality of factors that exist and where do we go from here. We will hear from Dr. Rutland and Dr. Hill, and they will be able to talk about their experiences and also the disparities that exist in healthcare. And now the moment we all been waiting for, let me officially introduce our speakers. Dr. Cedric Jamie Rutland, pulmonary and critical care physician in Southern California, national spokesperson for the American Lung Association. He is a CEO and medical director of the Rutland Medical Group and assistant clinical professor of internal medicine at UCR School of Medicine. Lastly, Dr. Rutland is also the creator of Medicine Deconstructed, a YouTube channel designed to address medical topics for the everyday person in everyday terms. Welcome, Dr. Rutland.
Hey, how is everybody doing?
And Dr. Hill, we also have here with us, who is our Vice President of Student Services. He is a heart and kidney recipient. He is our very own OneLegacy ambassador, and he was also the Donate Life Rose Parade 2019 Float honoree. Welcome, Dr. Hill.
Thank you, Tiffany. Glad to be here.
All right, take it away.
Look, it's June, right? June is Men's Health Month. It's always been Men's Health Month. And we have to raise our healthcare opportunities and focus on encouraging men and boys to be healthy. And the reason it's so important for men, us specifically, is that we die 5 years earlier than our wife. Some of this is genetics, but some of this is health. Some of my male patients, they don't want to go to the doctor. I had a patient literally just leave the office saying he didn't want to get a colonoscopy, even though it's his screening scheduled time. I mean, you know how it is, and the top 3 causes of death for men: heart disease, cancer, and then unintentional injuries. So those are the top 3 causes of death in men. When you think about cardiovascular disease, and this is a stat that I find amazing, 1 person every 37 seconds in the United States is dying from cardiovascular disease. Thinking about that stat, I wonder how many people every 37 seconds are dying of coronavirus, but that's besides the point. Nearly 650,000 people die from heart disease each year. So that's 1 out of 4, 25% of all deaths. And again, I look at heart disease as being somewhat preventable, right? Cardiovascular exercise, anything that raises your heart rate, eating healthy, all right? Resistance training and lifting weights. All of these things are healthy activities that can lead to some improvement here. So what I want to hear from you, Dr. Hills, I want to hear kind of your story and your journey as you transitioned through your life in healthcare. You can speak to us about how it was in terms of your ethnic background or not. It doesn't matter. It doesn't matter. I just want to hear about your story because I find it so interesting.
Well, I think it goes back to, and race and ethnicity always plays a factor in health. You're raised in a cultural background. Some of the foods that we eat, soul food. I like me some soul food. It's a little bit different when you're younger because you're a lot more active. I'm a veteran. I was an athlete all my life, and then life happens, and you get married and kids, and maybe some of your activities between your 20s and 30s, you're good. Once you start inching into the 30s and 40s, sometimes your physical activity wanes, and maybe your diet doesn't adjust. And I think that's a critical period, and really you should be focused on your health in a preventative way anyways. I think of not to say the body's like a car, but if you have a nice car or just a regular car, you're not going to wait till something happens to fix the car. It's going to cost more to fix the car, as an intervention as opposed to prevention. and maintenance with the car. I see and equate an analogy, the car to your human body. And I think if you really you're about wellness all throughout your life, irrespective of race or ethnicity, I think that's what we're talking about, trying to bring out awareness. Mm-hmm. Now, I'm somewhat educated. That doesn't always make you intelligent, or vice versa. Now, I may be educated, with a doctorate and everything else, but culturally or gender-wise, I've always believed in being invincible. And really, you should be focused on your health in a preventative way anyways. I think you're about wellness all throughout your life, irrespective of race or ethnicity. I think that's what we're talking about, trying to bring out awareness. Mm-hmm. Now, culturally or gender-wise, I've always believed in being invincible. Literally, my nickname is Superman. It's my moniker. And that is probably one of the worst things you could ever probably adopt, because the reality is you're not. When I was diagnosed with a cardiomyopathy in 2004, I didn't really know what that was. It didn't sound good. And I said, I was working out and doing some things. And, I said, Doc, like if you were my doctor, I said, Doc, kind of making light of it. I said, well, give me 2 of those pills and I'll call you in the morning. So I kind of lived with that for 12 years and just, my health deteriorated. They actually mentioned a heart transplant at some point in time. I think that triggered some of the things, and I can't generalize to all Black folks. I'm just going to say in some of the anecdotal, informal conversations around Black folks, we're very particular about our spirituality and our body. And I was like, and add that to the gender, the bravado, I ain't doing that. And I'm not doing that. So that is how I kind of went through the heart process, and health-wise, all that tied together added to some of my health issues, and maybe genetics too.
Right. Yeah, I do think it's important for the audience to understand what a cardiomyopathy actually is. So what a cardiomyopathy actually is cardio stands for heart, myopathy stands for muscle pathology. So okay. The way that your heart is organized, you have 4 heart chambers, right? And so if you're looking at your feet right now, I want you to imagine blood rushing from your feet after it's been utilized, and it ends up draining up towards the center of the chest into an area of the heart we call the right atrium. Blood from your head drains into a similar place, into the right atrium. The right atrium collects the blood from the body, sends it to the right ventricle. The right ventricle is the muscle of the heart that pumps the blood to the lung. There, once you take that deep breath in, the lung does its thing. Blood rushes back to the left side of the heart, to the left atrium, and then the left ventricle receives the blood from the left atrium and pumps that blood first up to the head, then back to itself through the coronary arteries, then to the rest of the body. Now, what a cardiomyopathy is it's an abnormality of those 4 heart chambers together that leads to less of a pump of blood. So what does that mean? That means that your heart is not delivering the blood that your organs need, your brain, your liver, your kidney, your skin, your muscle. And so your organs start to suffer. And when you develop that disease, it also leads to further organ failure. So if your kidneys don't get it, then your kidneys start to go. If your liver doesn't get it, your liver starts to deteriorate. And it becomes a significant problem. So what Dr. Hill is telling you is that I had a cardiomyopathy for 12 years, which means that he managed it very well. But it got to the point where other organs were suffering, and then what happened?
Yeah. Okay, well, fast forward to getting to Cedars-Sinai Hospital. Shout out to Cedars-Sinai, okay? And basically taking an Uber to Cedars-Sinai because of a stomach ache, barely get to the emergency room, take my vitals. I don't even remember anything after that. I must have passed out on the table as far as I know, woke up. There is like 50 doctors standing around me, and I got all kinds of tubes and wires in my neck and, all kinds of stuff. And the doctor tells me, you know, Dr. Hill, we're happy to see you. And I'm looking around like this, and I'm like, oh, okay, well, I'm happy to see you. I felt much better. They explained to me that I had passed out and my blood pressure had got critically low, and somehow they revived me. I don't know if it was a revive, or they were able to sustain my blood pressure back. And I felt great. I want to go home. You know, so I said, so I'm like, okay, well, I feel better. And they said, well, I asked her, I said, I feel better. Can I go home? And she said, not so fast. You know, I got good news and I got bad news. And I said, okay, you know, what's the bad news? He said, well, your heart basically is done. I was like, ooh, I hope the good news is better than the bad news. And the other news is that we are one of the number one heart transplants hospitals in the nation. And I do remember going through my visits and checkups, you know, they talk about the transplant. I didn't pay attention. I didn't, you know, I'm Superman. I'm not doing that. I don't even know what it is. So they explained to me the actual physical components and what they do and about the heart transplant. And I said, no. I'm not doing that. I mean, you're going to do this. You're going to get somebody. No, I'm not. Oh, nope. No. And then she got a little bit ethnic on me. And then she put her hands on her hips and like, well, behind door number 1, you can go home and you will die within 6 months. Not 6 months, 6 weeks. And behind the other door, you stay here and get a heart transplant. So that was my options. And my journey started from there. I changed my mind. And was there for about 2.5 months and went up and down. You know, there's some variations during that hospital stay, but there is the confluence of whatever your faith is, that was me, and the medical science, and just on some levels luck. But just really at the end of I'm literally bottom of the ninth, 2 strikes out, you know, I got a heart right before I was scheduled for a LVAD, and I left ventricle assist device. I was scheduled for the left ventricle assist device. It got postponed within 40 hours. I had been there 2.5 months and didn't receive a heart. Within 48 hours, the perfect heart came in and I didn't have to get the LVAD.
Wow. One of the issues that's kind of being focused on right now is the healthcare disparity issue. And when I say I'm talking about me, you know, African Americans, distrust in the healthcare system.
Oh, boy.
And it happens, okay? And even when I walk in a room, I already know that I'm behind the 8 ball. And I'm behind the 8 ball for several reasons. Some of the reasons may be that, you know, we just don't go to the doctor. Some of the reasons may be that they've been ignored or haven't had access to healthcare. We've been ignored. We haven't had access to healthcare for a number of years. And so it doesn't matter what I say, I'm playing catch up. I'm behind the 8 ball and nothing's ever good enough. But this is something that we have to correct. It's actually interesting when you survey Blacks, 30% of them believe that their health is dependent upon fate or destiny. So if this happens to them, it just does, right? It's not anything you can control, which I found like amazing. And the other thing is only 50% of Blacks believe that health is a high priority. And this is a number that we need to improve upon because 100% of people should feel that health is a high priority. It is. And I'm not saying, listen, you can't eat, you know, McDonald's or In-N-Out Burger or whatever you like to eat anymore. I'm just saying that, listen, a majority of the food that you put in your body needs to be nutritious and needs to be healthy. And that's something that we need to change. There's questions about whether or not Black people get coronary artery disease and diabetes more than other ethnic groups. And the answer is yes, we do. And we also die of it more often than anyone else. Strokes, heart attacks, all of the above. Reason is, I think lack of access to care. Yes, there's racism and racial disparity as well. But I think lack of access to care is probably a huge one. What do you think, Dr. Hill?
I think we'd be remiss to say, and I don't have the data, I should have probably brought it with me. All these systems, we talk about health systems, educational systems, criminal justice system. They're all intersectional in many ways. But the biggest disparity is economics. Okay, and I, I mean, in light of what's really going on, if we're going to have a real discussion, we have to talk about the history of the introduction of Blacks in this society as Africans. Okay, and it goes back to 450 some years. The economics. I mean, I'm not an economist, but if you do have an economist and you look at, access to healthcare costs money, access to great education costs money, getting out of the criminal justice system costs money. Okay, and so there's an intersectionality, in my opinion. It's anecdotal, but I mean, we could probably back it up with science as well. You can't you can't disassociate that from the equation. And then you have longstanding systemic racism. I've been fortunate to have great healthcare, but I was kind of crippled with my mentality of my intersectional gender and cultural identity. And so that probably took a hit in regards to that. But I've had access more, and my kids had access. But that does not mean that my cultural identity, what I identify with, did not play a significant role in terms of my healthcare and wellness. I still have to, like you said, Doc, I mean, I don't go to McDonald's or anything like that anymore, but to say that I don't want some soul food during Christmas time or some greens, that would be a lie. That would be a lie, but I'm just not eating like that, on a continuous basis anymore. So it's about getting the information, learning from some mistakes, and, God willing, that you're able to correct it. I had major corrective education. I'll say that.
Yeah. Yeah. And, solving the systemic disparity issue, health disparity issue, racial disparity issue, systemic racism is not something that can be done over a conversation. And I don't even know if we know what the right answer is, because as Dr. Hill had mentioned, our introduction into society was a very slow introduction, depending on who you were, which means you had lack of access to land, lack of access to jobs, lack of access to wealth, which leads to lack of an access of education. So we all know that fewer Blacks graduate high school and college, okay? We all know that unemployment rates are twice as high for Blacks than for whites, and all these things happen, but it doesn't mean that's not something that we can overcome. Again, I was raised in a way where I had to just absorb these things that were going to happen, right? My parents taught me this: just ignore it, absorb it, and keep moving forward. We had the means as a family to be able to send me to college, and then I was able to go to medical school and all of that. Not everybody has that type of environment, right? And so we have to create ways for them to develop some kind of advantage or skill to get there. Because again, when you come from nothing and get to something, it means a lot more than when you've already come from something and you become something. And we just have to find ways. I have to find ways to involve myself in those communities and let people know that, you don't have to play basketball or play football to get somewhere. I wear this surgical scrub hat. I'm going to show you guys. It says, I am more than an athlete. And so I walk around the hospital and I have this cap on. And people always kind of giggle, like, oh, you're more than an athlete. Did you play sports in college? Whatever, what'd you play? All that kind of stuff. And I say to them, and I look at them straight in the face, and I'm like, this isn't for me. This is for, this is for Patrick down there. This is for Timmy down there. This is for all the young African-American men that read that and can say that they can do more than just go outside and try to dribble a ball or catch a ball or whatever. They can do this. And so, it's just a really important message. And, there's a group of young African-American men that I'm a part of and on Instagram. And all we're doing is sharing these experiences and trying to figure out ways to increase our Black exposure to healthcare, and to, taking care of your body, taking care of yourself, taking care of ourselves, and trying to close that gap between lack of access of care for our community.
I think that's huge.
So the first question I'm reading says, what are some of the foods we should eat to lower inflammation and mucus in the body? You got any idea of the foods that you should be eating?
I say water-rich foods, diuretics, trying to get the water out of your body, stay away from high sodium foods that is going to retain water. Specifically, it's always fresh foods, stay away from processed food, but medically I'd probably defer to you.
Yeah. No, so, and he's right. And more than that is, again, like I mentioned, when you look at the pulmonary data, the lung data, and you look at inflammation in the lung, people that eat more vegetables and more produce, as opposed to people that are eating McDonald's, they have less inflammation in their lung. Why? This is why. There is a communication system in the body. So for cells to arrive in certain areas of the body, it requires cellular recruitment. In other words, once a cell sees something, your immune system might see something, see an inflammatory type of product. It's going to secrete molecules called cytokines or chemokines. And then it leads to more cellular recruitment, which is inflammation in certain areas of the body. In the lung, when you look at the COPD population, if you're not eating antioxidants like vegetables, then that inflammation can go unchecked and it keeps going and going and going. And those people are more inflamed than others. So eating from the produce section is extremely important. It accomplishes two things. One, you're getting healthy nutrients such as vitamin A, E, D, all the vitamins that you need from those foods. And two, your stomach gets full. So that way, if your stomach gets full, because it's breaking down all of those fiber-enriched materials and carrots and broccoli that I just ate, most of your diet needs to consist of these types of plants. It's just important. So that's how I would answer that question. There's another question. It says, we hear a lot about African Americans and others being somewhat more at risk with underlying conditions, such as the ones that we're discussing. Why is that so? Again, I think it's lack of access to healthcare, number one. But number two, this was an interesting theory that I heard a long time ago. When we were, during the slave trade, when we were on boats and brought over to the United States, we weren't fed, we weren't given water. And so the people that actually made it were people that have the genetic predisposition to hold on to sodium. When you hold on to sodium, you hold on to more water. Okay? And so you can remain hydrated longer. But when you hold on to sodium, when you have the genetic predisposition to hold on to sodium, that also increases your blood pressure, especially if you don't exercise to sweat off that chloride and that salt and to keep your weight down and things of that sort. And so that's another theory that I actually think scientifically makes some sense, which is very interesting. And in terms of, such severe COVID-19, now, first of all, just an educational point, SARS, coronavirus type 2, is the virus, and COVID-19 is the disease caused by the virus. So, so when you have the disease, diabetes and hypertension and obesity seem to be the biggest risk factors of severe disease, not of contracting it. Everybody's risk of contracting the virus is probably the same, right? We can all get the virus. But once you get the virus, the severity of the disease is based on those risk factors, probably because if you're obese, you have a little bit of inflammation already going on. That's probably why. Same thing with diabetes. And then hypertension could be because of the vasculature. So the virus can bind to the receptor called ACE converting enzyme receptor type 2, which is present not only in the lung on the type 2 pneumocyte, but also on the endothelium, on the endothelial cells, which are the cells that line your blood vessels, as well as present in the small intestine. So not only can you have sinus congestion as a symptom and shortness of breath, but you can also have loose stool because the virus can bind in your small intestine as well. So it's just something to think about.
Hey, Doc, what about stress as a part of that as well? Because that all is
Yeah.
related to that as well.
So stress increases the inflammatory response. So it's probably related in that sense. The more stress you have, the greater the inflammatory response as well. Let's see here. I have 2 sons. This is a question about sons. My mom has 2 sons, so I can relate to this situation. Neither of them are health conscious. My older son lives on his own, so I can remind him to get physicals. My younger one has the dark neck, signs of diabetes, diabetes in our family as well as hypertension. Any suggestions? So what do you think? What would you do if these were your 2 sons, Dr. Hill?
Oh my gosh, I got all girls, so it's
Me too. I got all girls too. I'm with you.
Yeah. I'm a girl dad.
Me too.
Oh my goodness, I'd probably be too hard on them, because I know how important, and I'd probably be pushing sports a little bit more, just for activity's sake. That's kind of what happened with me. I mean, we were always involved in sports, but I think in combination now we're much more aware of the diets. And so I think I would have to be comprehensively sharing that physical activity and diet. But, this generation is a little bit different than my generation. We responded to, hardcore, discipline. And I think things have evolved and changed. And this Generation Z in particular, that you have to really find ways to inspire them. And it's not some of the old school methods that we used to have. Coaching is different. Everything's different. Education's different. How you teach them is different because they come equipped with a lot of knowledge. But I think when you talk about the physical activity, there's probably something going on psychologically that they're not unlocking. And so in order to get to some of the things that are going on, or the reason why there's apathy about maybe their health, there's probably some other things going on. And you probably want to get to the bottom of that so that we're not shaming them about weight or diet or whatever that case may be, and just living a life of wellness. And that includes, and this is a big taboo for us, maybe even go to the doctor. But if you talk about a doctor and then you go to counseling or psychological service, that's a taboo on some levels in our culture. So I think wellness is holistic approach to wellness. The physical part is a part of that. And maybe the psychological, psychosocial part is a part of that as well, in my opinion. So I would try to expand upon that. Young boys, they're young men, excuse me. They need mentors. They need role models, and they don't get to see a doctor, like ourselves, and so Dr. Rutland and myself. So it is imperative, but I always take personal responsibility that all kids, all young men and young women too, they're all our responsibility. I don't care what color you are. I don't care what your culture is. I'm an educator. I educate all. And so therefore, get them in touch with somebody they can look up to. And that might be that message. Sometimes it comes from an uncle. My brother, my girls will listen to my brother more than will listen to me sometimes. So it's just finding the right fit. And you're not in this alone. So we're all in this together. I mean, like the slogan's been saying recently.
Yeah, the way that we've raised our children has changed. I have to be really sensitive these days because I got a 7 and 5-year-old little girls. But I remember when I was younger, and my grandfather, who was basically my father in my life, if he wanted to make a point, he made his point. And the way that he justified his point is, I remember one time my grandfather and my brother were in an argument. My brother was probably 20 years old. I'm 6 years old, 14. And my grandfather looked at my brother straight in his eye, and he said, "Son," he didn't say son, the word he said. He said, "I know more in 10 minutes than you know your entire life." Right? Which is true, because he was probably 75 years old at the time. Yeah. And it was just a different way of raising children. So this kind of lifestyle, at least for me, was not beat into me. That's not the right term, but it was, I was told no sugarcoating, no, not being sensitive. I was told that, listen, if you want to be healthy, this is what you got to eat, right? This is what you got to do. And I think that, there's a lot of political correctness in our society that I think masks a lot of problems in our society. And I do think that, obesity the epidemic of obesity in our country is significant. And I think trying to be politically correct kind of masks that problem a little bit.
I agree.
And
Yep.
I do think that if you see something that you think is unhealthy, you should be able to say, listen, this is unhealthy behavior that's going to lead to significant organ deterioration as you age. And if you don't correct this habit now, you're going to be paying for it in the future. And it's really tough because not everybody has that foresight, but somehow you have to develop it, especially as it pertains to your health. Because although anything can happen on a daily basis, you get hit by a truck, anything can happen. I understand that. I fully am aware of that. At the same time, raising children, raising a family, setting an example, you want to be able to be as healthy as you can. So that way your organs can operate at their optimum and you have a healthy life. I'm not saying that nothing's going to happen. There are genetic diseases. There are diseases that are required. But I'm just saying that you have a better chance of getting through it. The people with SARS-CoV-2 that are getting through it in the hospital, in the ICU, what do they have that others don't? They have reserve because their organs didn't have years of damage, right? Their kidneys aren't damaged. Their lungs aren't damaged from smoking and vaping. They just have one thing going on, not 10. And when you can contribute to those 10 things, that creates a big problem.
That makes sense. That makes a lot of sense.
There was a question about meat. How bad is eating meat for our health? So when you eat red meat, it does increase the cytokine interleukin-6. Interleukin-6 is a cytokine that leads to cellular recruitment in certain areas. Interleukin-6 is popular right now because it is one of the cytokines involved in cellular recruitment to the lung in SARS-CoV-2. So I would say when you eat red meat, you are probably more inflamed. This is not to say that I think that meat is the devil or meat is bad. I eat a little bit of red meat. I eat a lot of plants too, but I will say that, you know, the vegan movement that's taking place right now, which is people not eating meat longer and all that jazz, like, I do think that ethically it makes sense. I do think it's probably appropriate, but at the same time, I think the point, some people get lost in the extremes, but I think the point of this is eat more plants, eat more fruits and vegetables because it's important for your health, right? It's not that people, I've got vegan friends, they don't judge me because I had, you know, a piece of meat or I had a steak last week or whatever it is. They just want to make the point that, listen, if you eat more plants, you're going to be healthier. And when you look at the literature and you look at the evidence, that's 100% true. Water's important. I drink a gallon of water a day. There's a question for you. It says, have you met your donor's family?
I did answer. I typed that in case we didn't get, I'm trying to type some answers in case we don't get to some of them. That is one of the probably not only because I was involved. First thing is, yes, I have met them, and it was kind of serendipitous, and it's borderline, you know, whatever your faith is. My is Christian background. I feel it was very miraculous on many levels, and I talked to the donor's mom on a weekly basis and know the family. And God rest his soul, his name, I'll keep his name out of it, but he had a 7-month-old daughter at the time of his passing. And I've had the ability to be able to meet her and just, you know, some things work in very mysterious ways. That's what I will say.
Yeah.
I'm very thankful to that young man.
Yeah, that's amazing.
Yeah.
I think transplant stories are amazing. People need to understand that, you know, transplanting organs is a godly-like gesture.
Absolutely.
And it is, it's amazing when everything goes well. There was a patient of mine who had interstitial lung disease, idiopathic pulmonary fibrosis, activated by her eosinophils, which is a type of white blood cell in your bloodstream that causes a lot of allergy and can lead to inflammation. And she was very sick, admitted to the hospital. You know, she was deteriorating significantly. She was only 50-something, 57. And I knew what she needed. I knew she needed a lung transplant. She went to UCLA and she got transplanted in a month.
Wow.
And she's doing great at home.
That's beautiful.
So, yeah, it's beautiful, right?
Yeah.
I mean, organ transplantation is something that is very, very special. It's something that I like because it involves the immune system and immunology and cell communication, which you have to manipulate to make certain that the organ survives itself within that person's body. So I really, really appreciate that.
That's next level, Doc. That's next level. I mean, that's I mean, for you just to rattle that off, that's just next level, brother. I have to say that. I just had to say that. I had to give you a props.
No, you don't have to give me. I'm just doing my job.
Yeah, well, you do it well.
So there's some other questions that says, what would you recommend a Black man who wants to go to the doctor but is afraid of being treated indifferently? Come to me. What would you tell someone who's hesitant to seek medical care? I think that the profession of medicine and being a physician is all about education and educating individuals so that way they can make decisions based on facts, right? And I think right now, everybody can publish anything anywhere. And that's become an issue, whether you're on Twitter, Instagram, Facebook, TikTok, people just publish things and people believe anything. And so sometimes, you know, there are patients out there that don't know where to look and don't know where to go. And so they're afraid, like, do they go to this person or that person or that person? I think starting with a professional person with an MD or a DO to go and see them and to allow them the opportunity to explain why you need to see them again or why you need to follow up is of the utmost importance. You have to give us that opportunity. Sometimes physicians and patients don't click. There are patients, contrary to popular belief, that I don't get along with. They don't like my style. That's okay. If we don't, I will send them to another physician because it's important for us to be able to treat people and help people in a way that we see fit, that we think is most helpful. It's okay for you to question what we're doing or why we're doing it. I think it's important for us to answer that question, but I do not want you to confuse your Google search with my medical degree. So you have to understand that we are trained and we're doing what we think is best, but do not be afraid of the doctor. Interesting trick for those of you with young children that do not like to get shots. If you cough as you're getting the shot, you won't feel it. Now, this is a trick I learned years ago, but for some reason, the pain fibers get jumbled when you cough. And so you don't even feel it. So you get that shot and you cough, boom, gone. You don't even feel it every time. If you're getting an IV, if you're getting a shot, anything, you won't feel it. I promise you that. I tell that to my kids, and my kids don't feel it. When we go to the doctor and we go get their shots or whatever, their immunizations, they do that. Why it's so low in the Black male community, the registration rate. Probably lack of education.
Lack of education. They don't know. I mean, I was woefully undereducated. I'm going to give a shout out to OneLegacy. I am an ambassador now, so I'm much more educated. I still got more to learn, believe it or not. Like I said, we can be educated or intelligent in many things and be woefully unintelligent and uneducated in other things. And so I fall victim, I'm a part of that. So unfortunately, now I'm becoming more educated, and I try to educate others irrespective of race, culture, and gender identity.
We got to educate more. I got to be in the community more. I need to lecture my people more. I need to talk to my people more, have town halls like this, because it's important, right? It's important. Education is important. And developing the understanding of what we're doing and why we're doing it is extremely important. And that's something that we got to focus on moving forward. We should begin to conclude this. One, because we said it was going to be about an hour, and two, because I got to go to clinic.
Well, that's important. That's important.
I want to encourage everyone that listen, racial disparities exist. I'm not going to argue about that. So don't argue with me about that. Two, make healthy food choices. I want you guys to stay active. I want you guys to quit smoking, quit vaping. We can talk about that. Don't do either. They both activate the inflammatory response and also allow bacteria to adhere to the airway epithelium more strongly, so you'll get more infections. Want you guys to get regular checkups, at least yearly if you're 40 plus. And And again, one of the aspects that's become, or that has always been important, but is even more important in my field today, is this aspect of mental health in the physician and mental health in the general population. This pandemic is keeping everybody inside. Everybody's frustrated. Everybody is upset. And some people, quite frankly, need to be out of the house and can't be out of the house, right? There are certain things that I won't mention here that are happening more often because, you know, kids are at home, or wives are at home, or husbands are at home, whatever the case may be. And I understand that. And I think we have to have avenues for mental health treatment, and really just conversations such as this one. So I really appreciate OneLegacy inviting me, myself, Dr. Hill, us, to be here today. So thanks a lot, OneLegacy, and I'll let you guys take over to close it out.
Thank you, Dr. Hill. Thank you, Dr. Jamie Rutland. Thank you guys for just sharing and educating our community. It's very important. And to everyone that really just been a part of making this come to life. Thank you all to the guests who have joined and submitted questions, and to hear what these gentlemen have to say. I just want to say again, before I wrap, that this platform is created for you. This town hall is for you. We want to hear from you. OneLegacy wants to hear from you. And we want to make sure that we're providing tools and education that is essential for our communities to thrive. So if you have any ideas or suggestions for future topics, please feel free to submit them. And don't forget to discuss the importance of organ tissue donation with your families. I believe it starts there. You have to have a conversation. People need to be informed of what you're doing and what you know, and that way that you can educate others as well. So again, thank you, Dr. Rutland. Thank you, Dr. Hill.
Can I say one more thing? Please wear masks. If you're not going to do it for yourself, if you're not going to do it for me, and if you want to know about my story, do it for the donor that saved my life and his family, because they are expecting to hear his heartbeat. Wear your mask. Okay?
I agree, and here's mine right here.
All
Okay,
right.
there's nothing else. Thank you guys for this wonderful conversation, and everyone stay tuned for more to come. Thank you. We are taking a grassroots approach where we can hear from our community. This is an opportunity to engage in meaningful conversation. My name is Tiffany Jones. I am the Public Education, Communication, and Production Lead here at OneLegacy. And we are the front lines of educating people about donor registration and awareness. Our goal is to educate the public so people eventually feel comfortable to join the donation community. We are excited to kick off the town hall in June, which is Men's Health Month. I will be turning this over to two esteemed speakers, Dr. Rutland and Dr. Hill, if you'll wave your hands. But before I do, I just want to say that the public education team here has been very essential in getting this off the ground. And we have been working on this for a few months now. We knew we wanted to kick off this conversation in June during Men's Health Month. Then obviously with all of the social unrest going on in our country, we would be remiss not to discuss systemic racism and equality in today's topic. So the goal will be to discuss reality of factors that exist and where do we go from here. We will hear from Dr. Rutland and Dr. Hill, and they will be able to talk about their experiences and also the disparities that exist in healthcare. And so what two better men really to carry that conversation? Just so you know, our town hall series will run throughout the summer. Our next town hall will be in July. We'll discuss a variety of topics. So stay tuned for more information. And now the moment we all been waiting for, let me officially introduce our speakers. Dr. Cedric Jamie Rutland, pulmonary and critical care physician in Southern California, national spokesperson for the American Lung Association. He is a CEO and medical director of the Rutland Medical Group and assistant clinical professor of internal medicine at UCR School of Medicine. Lastly, Dr. Rutland is also the creator of Medicine Deconstructed, a YouTube channel designed to address medical topics for the everyday person in everyday terms.